All right, so continue with some back. When patients come in with back pain, obviously most of the time their tolerance is low as far as being able to tolerate bending over, lifting anything from the ground, so on and so forth. So what I like to do to initially increase their tolerance for the session, and of course long term, I go ahead and have them do some seated stuff. So one exercise I like to do is lumbar flexion. And we utilize a ball, physio ball, just to help facilitate the motion. Okay. So what we're gonna do is again take a chair up for us, have the patient take a seat. And what I like to do is have them scoot forward just a little bit, because if they're seated all the way back and they start to go ahead and get into that flexion, you know, you're gonna be in a lot more hip extension or hip flexion in the beginning. So when you start to bend over, you're just gonna be limited. Versus if you slide forward, it frees up some space so that we can get more range of motion if they have the capacity. So again, slide forward. Go ahead and take a ball, probably a little bigger than this one. This is a little smaller. What we're gonna do is slowly go ahead and roll the ball away. Okay, and again, to their tolerance. So maybe you can just tolerate this, that's fine. Try to have them sit there for at least 5 seconds, and then have them slowly come back up into extension. Okay, and this is where we have those, again, that lumbar flexion to get that stretch and tension. As we come back into extension, we're working a lot of those muscles that have some origins within the ribs, that surround the spine. Just to name a few, we have the iliocostalis muscles, we have the longissimus muscles, and the spinalis muscles, which are just kind of the umbrella terms for other muscles that are involved with those, that help us to get back into that extension. So again, getting that flexion, a little bit of extension. We can also do some lateral stuff too. Okay, try to better isolate one side. So in this case, if we're going out to the left, I'm stretching that right side. Again, holding it if they can tolerate it. And then get the opposite. I'm gonna go ahead and kind of roll the other way, okay? And then this is typically something we do to increase the tolerance for the patient as far as exercises. And typically they fare pretty well as long as we continue to do this in between as well. All righty, give it a shot.